Good afternoon. I will now call this meeting of the National EMS Advisory Council to order. Thank you, representatives, for joining us for the second round of meetings for 2023 session of NEMSAC. My name is Brendan Hayden, and I am honored to serve as the acting NEMSAC chair and moderator today. Warmest of welcomes to our newly appointed NEMSAC representatives and to those recently appointed for another term. Welcome back. We've had some lively discussions this morning. We're very happy to have a whole new group with us and very excited by the energy in the room. Meetings today and tomorrow will be held using a hybrid format, so we also welcome those returning to us virtually. As per custom, our meeting will proceed following the agenda. Representatives, please always remember this is a public meeting and to please hold your questions and comments until the floor is open for discussion and/or the chair recognizes you. At the designated time on the agenda, the floor will be open for questions and statements from the public during public comment period. In the event we are addressing an item of business when the public comment period is called upon, I will ask for that discussion to pause so we may observe the public comment period as it was published on the agenda. Now let us begin with our first order of business, introduction of NEMSAC representatives and their disclosures of conflict of interests. The chair recognizes Nanda Srinivasan, who is acting on behalf of the NHTSA acting administrator Ann Carlson. Nanda will provide opening remarks and administer the oath of office to the newly appointed NEMSAC sector representatives. Nanda?
Thank you again. Thank you. And KM, who's running the EMS section here, his last month marked the 1 year anniversary. So I first want to congratulate him for 1 year at EMS running the office as director. First of all, welcome everyone to the first meeting of the National EMS Advisory Council of 2023. I would like to welcome back NEMSAC representatives reappointed to the second term. Thank you for your continuing service. Our newly appointed representatives, welcome. You're joining in a very important body that helps support our EMS clinicians so that they can support their communities. NEMSAC provides you a forum for the development, consideration, and communication of information from a knowledgeable and independent perspective. We thank you for your willingness to serve, and we appreciate your expertise. NEMSAC plays an important role in supporting our EMS community. I encourage you to keep listening, reaching out to your fellow clinicians, and working to elevate EMS and 911 issues at the national level. NHTSA and the Office of Emergency Medical Services will continue to develop projects based on the recommendations of this group. In fact, thank you for your recently issued recommendations to NHTSA on how to improve post-crash care. Your highlights, your guidance on post-crash care is really important in safe system approach as we continue to implement the department's national roadway safety strategy. A lot of good work has gone in here, and your work on the field triage of injured patients and continuous quality improvement is really important. Your recognition of that is really important in us continuing our work in this area. And now it's my privilege to swear in the new members appointed to the National EMS Advisory Council. I encourage all of those returning for a second term to reaffirm your oath alongside new members. So at this point, I would like everyone to turn on the cameras, please, if you're on hybrid. So please repeat after me. I do solemnly swear or affirm that I will support and defend the Constitution of the United States against all enemies, foreign and domestic. That I will bear true faith and allegiance to the same. That I take this obligation freely. Without any mental reservation or purpose of evasion. And that I will well and faithfully discharge the duties of the office on which I'm about to enter. So help me God. Congratulations, and thank you for your willingness to serve again. Now I'll turn it back to GAM to introduce the members and review the disclosure of conflicts of interest. Again, thank you for serving your communities.
Thank you, Nanda. So, Mr. Chairperson, representatives, I will state the name of each sector of EMS represented. And when I call out the name of the sector you represent, please unmute your microphone, introduce yourself by name, location, and then please declare any conflicts of interest you may have. So we'll start with the members who were reappointed for a second term. Hospital-based EMS.
Paul Brennan, Lowell, Massachusetts, no conflicts.
Tribal EMS.
Dr. Danita Kohler, Alaska, no conflicts.
Local EMS directors or administrators.
Lisa Bascal, Houston, Texas, no conflicts.
Trauma surgeons.
Mark Estring, Rochester, New York, no conflicts.
EMS data managers.
Tom Markins, Indianapolis, Indiana, no conflicts.
EMS researchers.
Jason McMullen, University of Cincinnati, no conflicts.
Hospital administrators.
Brendan Hayden, Portsmouth, Rhode Island, no conflicts.
Public health.
Carol Jorgensen, Elm Creek, Nebraska, no conflicts.
EMS practitioners.
David Pfeiffer, Stanton, Kentucky, no conflicts.
Legislators. Consumers.
Dr. Ayo Ogunsola, I do not have any conflict of interest. Thank you.
And now for the members who are appointed for their first term. Educators. Quality improvement.
Mike Tegman, Santa Barbara, California. My potential conflict is that I work for First Watch. Simply.
Volunteers.
Wade Miles, Atlanta, Georgia, no conflicts.
State EMS directors.
Justin Romano, Nashua, New Hampshire, no conflicts.
Air medical.
Evelyn Byers, Spokane, Washington, no conflicts.
Medical directors.
Brandon Morchetti, Hot Springs, Arkansas, no conflicts.
Emergency physicians.
Kendall McKenzie, Jackson, Mississippi, no conflicts.
Pediatric emergency physicians.
Sylvia Usuanta, Pittsburgh, Pennsylvania, no conflicts.
PSAP call takers, dispatchers, 911. Emergency nurses.
Tabitha Bond, Indianapolis, Indiana, no conflicts.
Emergency management.
Dr. Frank Quintero, Westchester, New York, no conflicts.
State highway safety.
Brad Estoshan, St. Paul, Minnesota, no conflicts.
All right, thank you. Folks may have noticed that we introduced only 23 of the 25 NEMSAC sectors of EMS. In January, 2 members scheduled for reappointment announced that they would not be able to serve in the upcoming year. Those announcements actually were made after the period of solicitation had closed. So in March, we published another Federal Register notice soliciting applications to fill these 2 sectors. Applications were received through April 13th. And since then, the NEMSAC selection panel has combed through and selected candidates that they believe best represent the fire-based EMS sector and the private EMS sector. Those names have been forwarded to the Office of the Secretary of Transportation for review and approval. The NEMSAC selection panel selected their nominees for candidacy on the basis of materials submitted and in a manner that ensured equal opportunity for all people and avoided discrimination on the basis of race, color, religion, sex, gender identity, sexual orientation, national origin, disability, or age. Selection was undertaken in a manner that encouraged participation by members of underrepresented and underserved communities in accordance with Presidential Executive Order 13985. Names of nominees for candidacy will be evaluated by the Office of the Secretary of Transportation. If the Secretary is in concurrence with those nominees, the Secretary will appoint the candidates to serve as a government representative. Those appointed by the Secretary will be notified and will be expected to confirm their acceptance of appointment. It is our hope that those representatives will be appointed to serve and the Council will be 100% reconstituted by the NEMSAC's tentative meeting scheduled for August 9th and 10th of this year. Clary, how did I do on that?
Nicely. Thank
you. Stuck to the script. Okay. Thank you for the introductions and the opportunity to provide updates on what we're doing to keep the NEMSAC moving forward. Just one quick note, I am going to have to head out of here shortly. Normally I would stick around. One of our longest serving staff member, Dave Bryson, is receiving an award from our administrator for his work on investigating electric vehicle fires. In addition to being an EMT, he is a long-serving fire chief and has really helped lead those efforts at NHTSA. So we're all very proud of him, and I want to make sure I'm in the crowd cheering loudly. So, and again, thank you everyone for your service. Mr. Chairperson, I yield the floor back to you.
Thank you, Gam. Again, congratulations on your work anniversary, and thank you for your service. And on behalf of the entire council, we want to congratulate Mr. Bryson for his amazing work. So next, I'd like to introduce again Mr. Nanda Srinivasan. Mr. Srinivasan is here to provide an overview of FICEMS and NHTSA's involvement with FICEMS. Nanda, the floor is yours.
Thank you again, Chair. Good afternoon, NEMSAC representatives. Again, I'm Nanda, Associate Administrator for Research and Program Development at NHTSA. I also serve as the Department of Transportation FICEMS representative from NHTSA on behalf of our Deputy Administrator, Sophie Schulman. I'm here to provide background information on FICEMS and to tell you how NEMSAC interacts with FICEMS. FICEMS was established by Congress in 2005. It aims to enhance coordination and ensure strategic alignment of EMS priorities among federal agencies and throughout the nation to ensure quality care. Specifically, we identify state, local, tribal, or regional EMS and 911 needs, coordination with federal agencies, state, local, or tribal agencies, expanded or new programs, including grant programs for improving state, local, tribal, or regional EMS, and implementing improved EMS communication technologies, including wireless 911. Identify ways to streamline the process through which federal agencies support state, local, tribal, or regional EMS, assess state, local, tribal, or regional EMS in setting priorities based on identified needs, advise, consult, and make recommendations on matters related to the implementation of coordinated state EMS programs. 2 years later, in April 2007, NEMSAC was established as a nationally recognized council of EMS representatives to provide advice and recommendations regarding EMS to the Secretary of DOT and to the Federal Interagency Committee on EMS. We do it through the Office of NHTSA EMS here, who's organized this meeting. It is also important for you to realize that your advisory recommendations are of extreme importance to us, as they can often evolve into programs or project priorities for FICEMS the modes of Department of Transportation like NHTSA and the Office of Emergency Medical Services. I was just on another TRB talk just between the two meetings here. And what I mentioned to them is the importance of NEMSAC in telling us and setting us the kind of research and deployment agenda in terms of what we can do going forward into the future. Thank you for allowing me to provide this brief overview of FICEMS. Hopefully you have a greater appreciation for the relationship between FICEMS and NEMSAC and how you can contribute as much as I and others can do to FICEMS. I'm going to transfer now to GAM as he will talk more about each individual FICEMS agency work in the area. Thank you.
Thank you, Nanda. So we have several FICEMS members joining us today. I want to give each an opportunity to introduce themselves and their agency and tell you how they are involved with the work of FICEMS. In order to keep the meeting running in an orderly fashion, I'll state the name of the representative department and agency and pause to allow the representative to speak. So we'll start with the Department of Defense.
Yes, good afternoon, Gam. Are you able to hear me?
Yes.
Yeah, good afternoon. My name is Dr. Mark Gentleman. On behalf of the DoD FICEMS Principal, Miss Elizabeth Fudge, we welcome you as members of NEMSAC, and we wish you a very productive term. Ms. Fudge and I work for the Assistant Secretary of Defense for Health Affairs, who has the oversight responsibility for the Department of Defense's FICEMS activities. I appreciate this opportunity to briefly discuss how EMS is conducted within the department. Unlike many of the agencies who will be speaking after me, our office does not conduct day-to-day oversight of EMS within the Department of Defense. That is the responsibility of our individual services, the Army, Navy, and Air Force. And each service conducts its EMS activities in a slightly different manner, either functioning under a medical umbrella or under the installation in collaboration as part of fire and other emergency response services. Our office works with the services to ensure their interests are represented at the FICEMS, and we encourage their active participation on various committees that make up the technical working group. If any of you have questions regarding how EMS is implemented within the department, please do not hesitate to reach out to us. We look forward to working with you. Thank you very much. Gam, back to you.
Thank you, Mark. All right, Department of Health and Human Services, Health Resources and Services Administration, HRSA.
Thank you, Gam. Good afternoon, folks. My name is Teresa Morrison Kinata. I have the privilege of serving as a representative for the HHS Health Resources and Services Administration. Within our organization, our responsibility is to ensure and provide support for the health and well-being of our communities across the country. I serve at this moment as the Emergency Medical Services for Children Branch Chief within the Maternal and Child Health Bureau, Division of Child, Adolescent, and Family Health. Our primary purpose and service to the EMS community is to ensure emergency medical services for children are ready within both emergency departments and the EMS agencies and our workforce. Thank you so much for your willingness and your dedication as you represent EMS sectors across the country. We appreciate your time, and I applaud our partnership with NHTSA's Office of EMS. Their years of working with HRSA have demonstrated a great partnership to serve the interests of the EMS community. And we are here to help, support, and we listen very openly to your comments and your recommendations to ensure our programs represent the field and provide support where it's most needed. Thank you again for your time and your service.
Thank you, T. Administration for Strategic Preparedness and Response, ASPR. Next, the Indian Health Service. That the official representative is vacant. I'll just pause and see if there's any IHS staff that would like to speak. All right, I'll keep going. Centers for Disease Control and Prevention, CDC. We have a video for that one.
Hi, everyone. My name is Chris Cosmos. I'm from CDC. I am the Division Director for the Division of State and Local Readiness. Our mission is to work with state, local, tribal, and territorial public health agencies to improve their public health emergency preparedness and their response readiness. So I'm going to tell you a little bit about our division, as well as explain a little bit about my medical background, the work that I do on this committee, and how CDC works to improve the readiness and partners with EMS communities around the country. So I am a nurse by training. I started out in the city of Chicago in one of the large trauma centers there. I worked in ER for many years. And then from there went to the city of Chicago Department of Public Health, where I ended up working in the preparedness program and the healthcare preparedness program before coming to CDC. And then once at CDC, as I said, we are working to improve the response readiness of public health. And one of the things that we do is to work in partnership with EMS and EMS partners to improve their preparedness and work with them on emergency preparedness and response. For example, like in Ebola, we worked very closely with partners to help improve EMS readiness and infection control and give guidance on personal protective equipment, et cetera. And that's the role that I play on this committee, is to work in partnership and make sure that CDC is able to give the necessary guidance that to keep the EMS community safe, and to assure that we are working with them to make sure that infection control and personal protective equipment and those sorts of issues are brought to the table so that we can help improve readiness and keep our EMS community safe.
Thank you, Chris. Next up, we have the Center for Medicare and Medicaid Services.
Captain Skipping was unable to join us today.
Thank you, Clary. All right. Department of Homeland Security, Office of Health Security.
Yes, good morning all, or good afternoon. My name is Cameron Hamilton, the Director of EMS. Can you all hear me okay?
Yes.
Excellent. So again, my name is Cameron Hamilton, Director of EMS. I'm representing the Chief Medical Officer for the Department of Homeland Security. Currently, that is with Dr. Herbert Wolf, although we are appointing a new Chief Medical Officer for the White House that should be forthcoming in the following weeks. The Department of Homeland Security engages in many different responsibilities, specifically within the Office of Health Security. It is an office with a portfolio managing everything from healthcare systems and oversight, total workforce health and safety, operational medical support, as well as health threats resilience. A sub of that is the Emergency Medical Services Division, which oversees the medical standards and readiness for roughly 3,800 EMTs at various certification levels throughout the Department of Homeland Security. These individuals provide everything from workforce protection to emergency medical services for care of its employees, those within our care and custody, as well as the communities that we are engaged with and serving. I want to thank you all for serving here as members of NEMSAC. We've been a principal partner here with FICEMS, and we look forward to collaborating more in the future. Thank you for your time.
Thank you, Cam. Next up, the United States Fire Administration.
You hear me okay?
Yes.
I'm having some connectivity issues, so hopefully I stick with you here for that. But thanks for the opportunity and welcome NEMSAC, both the existing members and the new members. It's a pleasure to at least virtually see you. I know one of my colleagues, Greg Williams, is in the room, who really runs the helm of some of our EMS operations. But as some of you may know and others not, toward the latter part of last year, the U.S. Fire Administration reorganized. And beginning in January, we effectively changed our division name that I lead to the National Fire and Emergency Medical Services Division. And we are currently standing up a full operational EMS office within the division itself. For that, it's currently staffed with 4 people, but we have a lot more in the forthcoming, hopefully, months to onboard. As we expand our operations, as our vision related to EMS is an informed, unified, equitable, well-trained, well-resourced emergency medical services throughout the nation, we are going to work deliberatively to address a number of issues and concerns expressed by EMS over the past decades within disaster preparedness response, funding opportunities, and the like going forward. We maturate nicely with the Office of EMS at NHTSA and our other FICEMS partners. We are one of the original agencies of FICEMS when it was created. And actually were FICEMS long before it was statute, where it initially started at the U.S. Fire Administration. With that, the one thing I did want to share with the group is that every year, the FEMA administrator themselves issues a planning guidance for the year. And this year in FY23, we had a specific directive to strengthen emergency management workforce that identified state, local, tribal, territorial EMS capabilities at all hazards to be addressed in greater detail through training and program development and research. So that becomes fundamental to what I already expressed on part of the reasons why we're getting more active within the EMS. But keeping in mind that in EMS responses overall from the fire departments, 65% at minimum, all fire departments in the United States respond to a medical calls. That's their volume, and it ranges as high as nearly 90% in some fire departments. So we are going to work diligently over the coming years to address this. We have a comprehensive EMS needs assessment currently underway, which pretty much everybody in FICEMS that's on board, or I should say on this call right now, is participating in or has staff participating in. But we're going to address some topics within the national response framework as it relates to ambulances and emergency medical service operations, the EMS licensure compact for interstate portability, in addressing that and supporting it as we go forward. So anyway, we look forward to working with you both on NEMSAC and outside of NEMSAC itself, and encourage you to keep up the strong work of the positions that you frame for national policy for NHTSA's Office of EMS and NHTSA as a whole, but also in your advisories to FICEMS. We do take them seriously, and again, thank you for the strong work, and we look forward to engaging. Back to you, Dan.
Thanks, Rick. Federal Communications Commission, FCC.
Hi, hopefully everyone can see and hear me.
Yes.
Great. Hi, everyone at NEMSAC. It's nice to meet you, at least virtually. My name is David Firth, and I am the Deputy Bureau Chief of the Public Safety and Homeland Security Bureau at the FCC. The FCC has a unique role within FICEMS. It is not an agency that regulates healthcare or medical services or EMS directly. We are not medical experts. Our portfolio is the nation's communications infrastructure. And you may be familiar with a number of things that the FCC does, but the specific relevance to FICEMS is that the EMS, provision of EMS around the country relies heavily on communications in order to function, and in 2 specific ways. One is the 911 system, which enables members of the public to call for emergency medical assistance when they need it and to receive that assistance quickly. And the other component, the other communications component, is the radio and communication systems that first responders, including EMS providers, use when they are out in the field and responding to those emergency calls. And the FCC is responsible for various aspects of both of those systems. With respect to 911, we specifically regulate the carriers that the public uses to call 911. Those calls are routed to thousands of 911 call centers around the country. We do not directly regulate those centers, but we work with them as partners. And our primary objective is to ensure that the 911 system is accessible to the public, that it is reliable, and that when anyone in need of emergency help calls 911, that call will go through. It will be delivered to the appropriate 911 call center, and that the information will be provided about where the caller is located so that first responders can be dispatched to the scene as quickly as possible. And then with respect to those first responder radio systems, every state, local, tribal, and territorial public safety agency that provides emergency response, whether it's police, fire, or emergency medical, that radio system is licensed by the FCC. So we set up the technical rules for the spectrum that's used by those systems to ensure that they can operate free of interference and operate reliably. And we have thousands of licensees, including EMS providers all over the country, that we license and that we assist when they're in need of technical assistance, if they're having problems with interference or other issues like that. So I'm delighted to be here and to participate in this session, and look forward to hearing more of the discussion. Thank you very much.
Thank you, David. Next, representing state EMS directors.
Mr. Stephen McCoy wasn't able to join us today.
Okay, thank you, Claire. I want to thank all the FICEMS representatives for joining us today. I believe we can just roll next into the TWG introductions. So reporting to FICEMS is the technical working group comprised of staff from all the agencies, and it is comprised of 5 subgroups under the TWG: evidence-based practice and quality, data systems exchange and analytics, systems integration and preparedness, workforce safety, and education and training. These subgroups perform tasks delegated to them by FICEMS and develop work products that are aligned with the FICEMS strategic plan. If you're interested in reading the most recent version of the strategic plan published in 2021, you can go to the FICEMS landing page on ems.gov. So I'd like to give some time for each of the TWG subgroup co-chairs to introduce themselves. In order to keep things running in an orderly fashion, I'll state the name of the subgroup, and then I'll pause to allow either of the co-chairs to speak. So we'll kick it off with evidence-based practice and quality.
We're running a little bit ahead of schedule, so they may not have joined us quite yet. So let's go ahead and move on to the next group.
All right, thank you, Claire. I'll speak slowly then, that might help. Next up, data systems exchange and analytics.
Second verse, same as the first.
Got it. And I know that there are folks on for this next one. Systems integration and preparedness. We may have lost T, but the other co-chair is available. Hi everyone, I'm Gam Wiche-Tunga. I'm the co-chair of the Systems Integration and Preparedness work group, and I just want to echo, I know what you've heard earlier before about your recommendations on improving post-crash care. One of the things that that this subgroup has been working on is a similar letter regarding the National Roadway Safety Strategy and post-crash care. So we've leaned very heavily on the recommendations that you issued to NHTSA and to FICEMS. So we appreciate it. Next up, workforce safety.
I work with Rick Patrick and at the U.S. Fire Administration. Also co-chair the Workforce and Safety Committee with Dave Bryson from NHTSA, and he is getting a very well-deserved reward for today, and really proud of him. So just wanted to give you a little update. We do pretty much anything having to do with workforce and safety, which are two of the biggest areas of work that we have to do in EMS. Promoting reporting, measurement, prevention, and mitigation of occupational injuries, deaths, exposures to serious infectious illnesses in the EMS workforce, supporting the development and use of anonymous reporting systems to evaluate medical errors, adverse effects, events, and near misses, and evaluating FICEMS' role in supporting implementation of the strategy of the National EMS culture of safety, which one of the big things that we're working on right now is pulling the EMS culture of safety back up from the previous work that was done before and updating it for the new century here. So happy to work with everybody here. If there's anything you ever need, Dave's always the much more outgoing one. I'm usually the one that's kind of quietly doing my thing in the back. So if anybody needs anything, though, I'm always here to help. So thank you very much.
Thank you, Greg. I'm confident that we have speakers from the next subgroup as well. Education and training.
Hi, that's me. I'm Clary Mole. I'm an EMS specialist in the NHTSA's Office of EMS. As a co-chair with Michael Sterno of the United States Fire Administration, we bolster a couple of the objectives of the strategic plan. Namely, we promote the implementation of the EMS education agenda for the future to encourage a more uniform EMS education, national certification, and licensing process at the state, local, travel, and territorial levels. We promote the use of technology, training, and equipment known to enhance the safety of EMS practitioners. We work side by side with the subgroup that Greg Williams just introduced a few seconds ago, workforce and safety. We also try to identify and develop strategies to close preparedness gaps in the EMS and 911 systems. So we meet on a monthly basis, and when we do, we discuss primarily the EMS workforce and as education serves as its pipeline. We're currently working on developing dashboards that we'll be able to show at FICEMS meetings in the future. Hopefully, you'll be able to register for those FICEMS meetings, join us, and see how things are going with the National EMS education system in the near future. Also wanted to put out there on my, well, I'll save that for a little bit later. Thanks, sir.
Thank you, Clary. Let's circle back and just see if we have anyone from evidence-based practice and quality. We're still running, I think, a little bit ahead of time, so I'll speak even more slowly. And Clary, maybe if you see anyone hop on the line, just let me know. Data, system, exchange, and analytics. Okay. We'll keep rolling. Mr. Chairman, without objection, we'll go right in next to OEMS staff member introductions.
Please do so.
All right. Thank you, sir. As I did with the TWG, I'll continue to speak slowly and want to give each office staff member an opportunity to introduce themselves. I'll go slightly off script. Is that okay, Clary?
Yes, if you have to.
Okay. I do want to thank my staff. As it was noted earlier, I just passed the 1 year mark as office director. That it's been they've been furiously at work over the past year training me up, and I deeply appreciate that. I think, as you all know, we have a very experienced and skilled staff. My predecessor John mentions that all the time, and it's true. I would not have made it through the past year without them, and I appreciate them. Do we have any other TWG folks on? Okay.
Thank you, Claire. Are you able to hear me okay?
Yes, sir.
Thank you. My name is Max Severide. I'm one of the emergency medical services specialists with NHTSA's Office of EMS. And myself, as co-chair with Diane Pilkey of the Emergency Medical Services for Children program at HRSA, helped to co-chair the Evidence-Based Practice and Quality subcommittee or group within FICEMS. I have been with the Office of Emergency Medical Services for about 4.5 years now. Prior to that, with about 10 years of work in highway safety grant management with NHTSA's regional office out in Seattle, Washington. I'm actually out in Seattle now, where I work remotely for the Office of EMS. And I look forward to speaking with folks in person and over virtual meetings as well. And I'd be more than happy to tell people more about the Evidence-Based Practice and Quality Group. We meet on a bi-monthly basis currently. Recently, we've had a number of discussions and presentations by partners focusing on evidence-based practice and guideline development, and also trying to inform the FICEMS on opportunities in pushing the envelope and promoting evidence-based guidelines and otherwise. So welcome to the NEMSAC, and look forward to working with you more.
Thank you, Max. Okay. So we'll come back later and see if Data Systems Exchange and Analytics folks are available. The current co-chairs of that group are Rachel Abbey from the Office of the National Coordinator for Health at HHS and Dave Milstein from USFA. So on to introductions of the Office of EMS staff. We'll kick it off with Brian Tegmeyer.
There's a video for that.
Great.
My name is Brian Tegmeyer. I'm the coordinator of the National 911 program in NHTSA's Office of EMS. The National 911 program has 4 goals to advance 911 across the country. We work to connect the nation's over 5,400 911 centers and their system of systems to ensure seamless operations. We collaborate and convene stakeholders to work on a variety of issues to improve and advance 911. We work to create and share resources, most of those resources of which can be found on 911.gov for the benefit of our stakeholders. And finally, we work with the Office of EMS and all of our NHTSA colleagues in 911's role of improving post-crash care. I look forward to working with all of you and all of the members of NEMSAC.
Okay. Next up, Kate Elkins.
Hi, my name is Kate Elkins. So I am one of the unusual members of the Office of EMS. I am 50% EMS and 50% 911. So I cover issues both for EMS and the 911 community. I am still an active 911 response paramedic and a member of Maryland Task Force 1's Urban Search and Rescue team. So I'm still out in the field a little bit. Still occasionally teach paramedics at a paramedic program. And I have been with the Office of EMS almost 5 years. So in the office, I work on projects related to rural and tribal issues, mental health and wellness, suicide prevention, emerging infectious disease, and then within the 911 space, 911 GIS, migration to next generation 911, as well as professionalization and education of the telecommunicator. I'm really looking forward to collaborating and working with you all on issues related to all of those topic areas, and any way that I can be of help.
Thank you, Kate. Jeremy Kinsman. Okay, let's circle back. Why don't we go back to Max Severide?
Thanks, Gam. I'll tell a little bit more about myself. So I had actually a background in mostly in vascular surgery research at the University of Washington here in Seattle, which really brought me into injury research, and then ended up starting work originally 15 odd years ago with the National Highway Traffic Safety Administration, which really brought me into grant management work with the highway safety efforts and partners in the regional offices, the regional office covering the states out in the Pacific Northwest. And then for the last 5 years with the Office of EMS, part of my focus areas include making sure that we have outreach and understanding of EMS and 911 issues by the highway safety community, in addition to the evidence-based practice and quality efforts that I work on. So again, welcome, and look forward to working with you.
Thank you, Max. And Max has really been leading our efforts in really taking the NEMSAC's post-crash care letter and communicating that with our 10 regional offices, who have in turn been taking that gospel to their state highway safety officers, and really excited about that ongoing work. We've had a lot of conversations now around post-crash care between state offices of highway safety, EMS, and 911, which I think is really critical moving forward as we try to achieve 0 deaths. So thank you, Max. Next up, I think he's here, is Clary Mole.
Yes, I'm still here, but I'm going to yield the floor to Jonathan Green. He's joined us from Asper, and let him give his introduction.
Great. Thank you.
Thanks, Clary. Thanks, Gam. My name is John Green, and I work here at the Administration for Strategic Preparedness and Response, known as ASPR, previously the Assistant Secretary for Preparedness and Response. We engage and support EMS in a whole number of ways. You may know some of the work that we do through the Hospital Preparedness Program, leading and managing the emergency support function 8 with our ESF partners, part of the National Response Framework. And then in the NDMS program, National Disaster Medical System program, there are a large number of paramedics who actively support responses. And then finally, the CONTOMS course, the premier course for teaching tactical medicine for supporting law enforcement agencies, is housed here within ASPR and is within my portfolio. I'm an advocate of EMS because I grew up in EMS. I've been a paramedic since 1990, and prior to assuming a federal career, I had a long career in EMS. And here at ASPR, I currently serve as the Deputy Assistant Secretary for Preparedness and Response and lead the Office of Response. Thank you.
Thank you, John. Good to see you.
We're going to continue to play catch up and let Dave Milstein join us. He is in the Data Systems Exchange and Analytics subgroup of the Technical Working Group. David?
Hi, good afternoon. First of all, audio, hear me okay?
A little bit of in and out. Maybe lean a little bit closer there, Dave.
I'm going to turn off my video. I think on our end. All right, good afternoon. Hopefully this is better. My name is Dave Milstein. I'm the co-chair of the Data Standards and Subcommittee. Currently, I'm the branch of the National Fire Data Center, the Fire Administration, and a 20-year emergency services at the firefighting. Here at the National, we run the reporting system.
Dave, your audio's a little bit in and out.
I think it's why, unfortunately, I'm the best I can. So we run the National Incident Reporting System here, also known as NEMSAC. This is a fire incident response-based data collection system where we capture approximately 30 million incidents from 25,000 departments across the country. Soon, yesterday, will be known as the National Emergency Response Information System, aka NERIS, or replace our current NFIRS in the coming years to better align with the needs of the emergency response community. The chair of our committee is Rachel Abbey. She is from unable to be here today. She is from the Department of Health and Human Services, Office of National Coordinator for Health, IT. Our group members represent state EMS, Department of Transportation, CDC, DOD, and the Office of Rural Health Policy. Some of our work group goals are to identify and promote best practices to reduce health disparities through coordinated and integrated federal, state, local, tribal, and territorial EMS and 911 system that provides safe, high-quality patient care. Next, data-driven, evidence-based, and standardized EMS and 911 systems that help to improve the quality of out-of-hospital patient care. This can be achieved through the promotion of standardization and quality improvements by supporting the adoption and implementation of NEMSAC compliance system. Finally, EMS and 911 systems that are people-centered, sustainable, forward-looking, and integrated with the overall healthcare system. This includes fostering relationships between federal and SLTT, EMS, and one stakeholders to enhance to enhance information sharing and data integration between EMS and 911 organizations. I'm looking forward to working with this group and our future engagements. Thank you for your time.
All right, thanks, Dave. Clary, do we have anyone else from the FICEMS crew on?
Not FICEMS yet, but we did have another Office of EMS staffer join us. Eric Cheney's online.
Hi, good afternoon, everyone. My name is Eric Cheney. I'm one of the EMS specialists in NHTSA's Office of EMS. I'm in my 37th year in emergency medical services and a career that's had me working in state government, at state EMS offices, and multiple federal agencies in emergency services and emergency management programs. My primary responsibility at NHTSA's Office of EMS is the National EMS Information System. I serve as the project manager on that with Clay Mann at the University of Utah, who serves as the principal investigator. NEMSAC collects data from all 50 states, 3 territories, and the District of Columbia. In 2022, just over 51 million records were collected from just under 14,000 EMS agencies throughout the country. All that data is then synthesized at the national EMS, at the national level. It is shared through various data use agreements with local, state, and federal agencies. It's my pleasure to work with you, and I look forward to working with the various subcommittees that we've supported in the past for all your NEMSAC data needs. Thank you for serving.
Thank you, Eric.
Cam, I think we're all caught up now. I'm Clary Mole. I'm an EMS specialist for the Office of EMS at NHTSA. My background is county-based EMS and hospital-based EMS. I've been in EMS for almost 20 years now. The projects that I work on the Office of EMS include FICEMS and NEMSAC, the committees, their coordination and project management, program management. Also work with education product and projects at the Office of EMS, disaster preparedness. I get to do a lot of great work with the Office of EMS. I'm proud to do it. So I'll yield it back to Cam.
Thank you, Clary. And the two remaining, again, we are running ahead. So the two remaining staff members that we have are Jeremy Kinsman and Dave Bryson. And Dave is at the awards ceremony as we speak. I'll be going in there fashionably late is what I'm going to say. But again, want to thank all the Office of EMS staff and the FICEMS crew as well. It's a very big team, I can say, across the board. All of us are very dedicated to the mission. So it's a great team to be on, and happy to welcome you all on board as well as the NEMSAC to help guide us. So on that note, I don't think I went too far off script. Clary's managed to keep me within my lanes here, but Mr. Chairman, yield the floor back to you.
Thank you, Gam, and thank you for making it here today, despite having to be in 5 other places at the same time. So we really appreciate your presence today and your leadership of the council. At this time, we're going to take our observed break. It's going to be a little longer than what was the 10-minute scheduled break, but we are due back at 2:45 Eastern standard time. So at this point, we shall pause and reconvene shortly. Okay, good afternoon and welcome back from break. It's now time to transition to the business of electing a chair and vice chair of the National EMS Advisory Council. I will now open the floor for nominations for the position of chairperson. Ms. Faskell.
I'd like to nominate Brendan Hayden for chair.
Thank you, Ms. Faskell. Are there any other?
I'll second that.
Thank you. Brendan Hayden has been nominated and seconded. Are there any other nominations? Okay, hearing none, I will accept the nomination, and I would ask for a vote to close the nomination process for chair.
I'll make a motion to close the nomination for chair.
Thank you, Dr. Gestring. Is there a second?
I'll second.
Thank you, Mr. Arkins. Hearing no other discussion, I would ask for an oral vote to elect Brendan Hayden as the chairperson of the NEMSAC. All in favor?
Aye.
Aye.
Any opposed? Any abstentions? So moved. Thank you. I'm honored and a bit humbled. Hopefully I will carry out the role appropriately and serve not just the committee's interests, but the interest of our industry. So thank you very much. Thank you, Dr. Gestring. Next is the election of the vice chair of the committee. I'd like to open the nominations. Dr. Gestring.
I'd like to nominate Thomas Arkins.
Thank you, Dr. Gestring. Is there a second?
Second.
Thank you, Dr. Orgonzola. There has been a nomination and a second for Mr. Arkins. Are there any other nominations for vice chair? Okay, hearing or seeing none, I would ask to close the nomination process for the vice chair.
So moved.
Thank you. Can I have a second? Thank you.
Second.
Thank you very much. Hearing no other discussion, I'd like to take a vote for the election of Mr. Arkins for the position of vice chair, just by signifying by saying aye. All in favor?
Aye.
Any opposed? Any abstentions? Congratulations, Mr. Arkins.
Thank you to the council and the chair, and I look forward to working with everyone this next couple of years, and hopefully we can do some good things.
Now we are really way ahead of schedule. All right, so we have actually come to the point where we're going to do some subcommittee reports. As certainly the members of the committee know, and hopefully the public knows, there are essentially 6 committees of NEMSAC, and there is an ad hoc committee of NEMSAC, and each committee is just going to give a brief overview of each subcommittee is going to give a brief overview of their progress to date and what they're actually working on. So we'll start with professional safety. Dr. Gestring.
Chairman Hayden, I think you were wanting me.
Oh, pardon me. I am so sorry, Carol. Yes,
That's okay.
already shirked my duties.
That's okay.
Yeah, no.
The Professional Safety Subcommittee has one advisory in the research phase right now, which is crash scene safety for EMS responders. Due to term limits of some of the subcommittee members, we wish to keep this advisory in the research phase. We are looking forward to the addition of new members being appointed. However, in the subcommittee meeting this morning, when we had discussions about that topic, it was suggested to possibly expand the advisory to include all crash scene safety for all individuals on scene, not just the EMS responders. So we will take that into consideration as we move forward with that. And then as a second topic that we discussed this morning, we would like to propose later is a topic on helicopter landing zone best practices.
Thank you. Any comments or discussion for the committee, for the subcommittee? All right. Thank you very much, Carol. Next, integration and technology.
So my name is Tom Arkins. I'm the acting chair for the subcommittee of integration and technology. We've got 2 that were in the research phase. We're hoping to move in the draft phase. The first one being is data management. pathway, so how to make EMS, how to create a course for EMS data managers, so we can train people to actually understand, utilize better utilization for EMS data in research and operations, clinically, just make sure that we've got a whole process in place. Second one we're working on is the impact of public law 115-383, which is for protecting patient access to Emergency Medications Act 2017. Basically, this is guidelines working with NEMSAC and other agencies to try and build a common framework or structure where people can go and utilize and find out what they need to do in order to get a DEA license for their controlled substances, make sure that they're following all the right rules and everything. So it's a big change in what we've been doing for years. There's so many different variables out there, and make sure there's a process that nationally EMS providers can look to.
Great, thank you, Tom. Any questions or comments for Tom in the subcommittee? All right, fantastic. Moving on, preparedness and education. Lisa?
We have 2 advisories in progress. One advisory is on ensuring optimal emergency response of a fully integrated 911 and emergency medical dispatch system. This advisory is focused, that we've spent some time on, is focused on increasing access to 911 services, to next generation 911, to emergency medical dispatching in any variety of the proprietary systems, and basically, increasing people's access to 911 care and appropriate emergency medical care. There's also a focus in the advisory on recognizing telecommunicators as first responders and not secretarial staff. This advisory we've spent some time on. Last meeting we brought it to interim status. We hope to bring it to final status or for a vote for final status at our next meeting. Also in research right now is our advisory on large-scale incidents and preparedness, pre-planned and unplanned events. That is really very much in draft or in research, and we hope to continue working on that as the summer progresses.
Thank you, Lisa. Any questions for the subcommittee? Any comments? Great, thank you. Next up is the Equitable Patient Care Committee. Dr. McMullen?
Thank you very much. As the acting subcommittee chair, I'm happy to discuss the current advisory that should be in draft mode, which is equitable access to EMS regardless of population density. The overarching goal of this advisory is to better describe and quantify the challenges and perhaps even the healthcare deserts, so to speak, that are faced by rural participants. Dr. Kohler has been very instrumental in guiding this. We are, it says here, sir, that we are in interim status. Tomorrow, if that is indeed the case, I will be making the motion to keep this into draft status because we still have some considerable work to do.
Very good. Thank you, Dr. McMullen. Any questions or comments for Dr. McMullen? Okay. Next up is the Sustainability and Efficiency Committee, of which I am currently the acting subcommittee chair. We have our advisory, which is in draft status, and at the next meeting of the NEMSAC with some modifications that were recommended during today's work group this morning will most likely be set to advance to interim. The title of the advisory is the Annual State of EMS System Financing, and the purpose of the advisory is to take the previous body of work that articulated and highlighted EMS financing challenges and put it into a more workable document that can be updated on a every 2-year basis, if you will. There are, I think, 11 or 12 individual recommendations as part of that advisory that speak to topics such as the government preparing an EMS toolkit on financing that individual departments and services can use to try and guide them in not just doing a better job of structuring their own internal financing, but also controlling their data, using their data appropriately to create a sustainable system, and also highlighting opportunities for them to recoup more capital to be able to fund their departments appropriately. So as I said, that currently is in draft status. We have some minor changes we'll be making to the document over the next month or so, and we'll look to advance that to interim status at our next meeting in August. Any questions or comments? Okay, thank you. Next up is adaptability and innovation. David, are you still with us?
Yes, I am. Can you hear me?
Yes, sure can, David. Go right ahead.
Oh, thank you very much. I regret that I can't be there in person with the rest of you, but looking forward to participating virtually. I'm serving as the acting subcommittee chair. And right now, our subcommittee is discussing the proposal designation of graduate prepared paramedics as federally recognized practitioners. This advisory would call for the establishment of Master of Science of Paramedic academic programs as basically a pre-hospital focused equivalent to Master of Science in Physician Assistant Studies or Master of Science in Nursing types of programs to prepare a new kind of paramedic who is prepared to function as a true practitioner. It furthermore would call on relevant federal entities, including CMS and Secretary of Transportation, Secretary of Health and Human Services, to designate those individuals as practitioners under federal law and regulations, just as they have in the past for physician assistants and nurse practitioners. It is in research. We're hoping to advance it beyond that point. Our committee meets tomorrow morning to continue discussion on this advisory. I'm happy to take any questions anyone has.
Any questions for Interim Chair Pfeiffer? Thank you, David. Next up is now Dr. Gestring with the Ad Hoc Ambulance Motor Vehicle Crash Subcommittee.
Thank you. It's my privilege to introduce this work that's been done now over 3 different NEMSAC terms. This advisory is still in draft form, and as you mentioned, this is an ad hoc committee looking at the issue of ambulance crashes. So this committee will cease to exist once this advisory advances. The title is Development of a Comprehensive National Ambulance Crash Data Collection Platform to Better Understand Current Crashes and Guide Future Preventative Strategies. And this is based on the fact that there are currently no national safety standards for ambulances, and there's currently no real way to answer the question of how often are ambulances crashing, and how is it affecting the occupants and the other people involved. So this document, following an extensive period of research, this document is calling for a development of a national ambulance crash data collection platform, which will contain specific factors which really should be defined by the EMS professionals involved in this work. But essentially, the development of a platform where data related to crashes can be obtained, and ideally strategies for prevention of injuries related to ambulance crashes can be undertaken.
Thank you, Dr. Gestring. Any questions or comments for Dr. Gestring?
We did have the opportunity to discuss this this morning in our subcommittee meeting with some of the newer members. So I expect with the new assignments of committees that I expect we'll get some new energy around this topic and really be able to bring this home over this next term.
Great. Thank you, Dr. Gestring. We are running a bit ahead of schedule. We're just a very efficient committee. I think what we will do is we have public comment that's coming up in about 20 minutes, and it probably makes sense at this point to announce the committee chairs for our next session, the subcommittee chairs for our next session. I'll get that committee thing right for the next meeting. So I think what we'll do is we'll just run through who those chairs are, and tomorrow we'll announce the memberships of those individual committees. subcommittees. So I'd like to start off with the Professional Safety Committee. The Professional Safety Committee, the chairperson will be Carol Jorgensen, moving forward for the next session. Carol, I'm assuming you accept the position?
Thank you. Yes, I accept.
Thank you, Carol. Integration and Technology will be Tom Arkins. Tom, it's the second thing you have to accept today. I'm assuming you're okay with that?
Yeah, I'll accept that.
Thank you. Preparedness and Education will be Lisa Baskell. Lisa?
Thank you, I accept.
Great. Equitable Patient Care will be Dr. McMullen.
Thank you, sir. I accept.
Great. Thank you. Sustainability and Efficiency will be Mr. Paul Brennan.
Thank you. I accept.
Thank you, Paul. Adaptability and Innovation will be Mr. Pfeiffer.
Honored to accept. Thanks very much.
Thank you, David. And the Ambulance Ad Hoc Motor Vehicle Data Safety Committee will be Dr. Gestring, subcommittee.
Thank you for the opportunity. I accept.
Great. Okay. So now we're only 19 minutes ahead of schedule. Clary, some guidance. Do we go to a break here or?
You can go ahead with some of the work of tomorrow. Most folks should have had an opportunity to read the minutes.
Yeah.
I sent it to them via email. If you want to go ahead and approve those, you can move forward with that. So you
Yeah.
don't have to do that first thing tomorrow morning.
Yeah. Yeah, I think we did. Everyone have an opportunity to review the minutes from the February session? Okay. Are there any amendments, edits, changes recommended?
Clary, there was a misspelling typo. Does that need to, do I need to make a motion to accept as amended, or? So there was a typo that was found.
Okay.
That I believe Clary has addressed, so otherwise I would motion to accept them as amended.
It was the spelling of someone's name. That's the only thing.
Okay.
So.
Are there any
It's been
other edits, amendments, or changes that are recommended? Hearing none, I heard a motion to accept.
I'll second it.
And we have a second. If you can all acknowledge for those in favor, please unmute and say aye.
Aye.
If there's any nays, please unmute and say nay. And if there's any abstentions, please unmute and say I abstain. Hearing none, the minutes are approved with edits. Okay, we are now 17 minutes ahead of schedule.
Tomorrow you've got planned to talk a little bit more in depth about proposals.
Correct.
And now that you've announced the subcommittee chairs, it might not be a bad idea to go forward with those proposals, discuss them today, so people have overnight to chew on them, and then maybe you can vote on whether to accept those tomorrow.
Sure. Yeah, there were essentially, and there were several recommendations that were discussed at our morning session for potential advisories for subcommittee work moving forward.
Morning subcommittee sessions, not
yes, correct.
council meeting.
Yeah, and those were to focus on some MIH strategies for funding. There was helicopter, an advisory on potential helicopter crash scene safety to prevent crashes, best practices. Landing zone safety, yeah. There was a discussion about care disparities that was brought up. There was pediatric preparedness that was discussed. There was Leave Behind Naloxone program, I think that Dr. McMullen raised. And there was a data integration with outcomes at hospitals that was also discussed for potential proposal. Does anyone else have any other potential proposals they'd like to discuss or bring up for potential adoption in subcommittee work? Ms. Baskell?
Give me a little bit of patience on this one because it's a it's a very fresh idea, but perhaps it's time to consider writing a advisory on EMS response to violent incidents or active shooter incidents. It's definitely something that's becoming more commonplace in our nation, and more EMS agencies are having to respond to. In the preparedness realm, considering different aspects of this kind of response, so just different destinations, multi-agency coordination, communication skills, working on, access to bleeding control equipment and supplies, the role of, EMS and these kinds of incidents. This might be a topic worthy of more discussion and brainstorming to flesh out a little bit better to consider a future advisory on.
Great. Sounds like a great topic. Very timely topic. Are there other? Dr. Usansa?
Yes, thank you, Chair. I just wanted to mention that in regards to the pediatric preparedness, we did discuss potentially there is already work being done through HRSA, through the Pediatric Pre-Hospital Readiness Project, that maybe we'd be better suited to prepare a letter to support the work that's being done, specifically a toolkit, but that end product is not predicted to be completed until May of 2024. So I just wanted to bring that to the representative's attention.
Thank you. Dr. Gestring?
So just in support of that, I would say that's the same strategy we used for the NHTSA field triage guidelines. So we planned a letter of support that came out shortly after they were finalized. So so if we're planning to do this in May, we could certainly begin the work of crafting that document ahead of time so that the two would come out somewhat close together and get a much bigger national audience for the pediatric preparedness work.
All right, just to understand the process there, if it's a letter of support, it would come from the subcommittee up to the full committee for a vote and then be promulgated? Yep, got it. Okay. Thank you. Any other?
That sounds like a preparedness activity, so I would recommend that it comes from education and preparedness.
Yeah.
Instead of creating a subcommittee for it.
Yeah, agreed.
And then it will need to go in a draft form long enough for public comment, and then the next time it could move to final. Remember, with letters, there is no need for an interim phase.
Right. Thank you. Dr. Quintero.
I'd like to propose looking into a new adaptability and innovation strategy for new technology and methodologies for efficiency. As you all are aware, during this last winter season, we were attacked by this triple pandemic, RSV, flu, and COVID. One of the things that I noticed around my region in New York, all of the Westchester and Lower Hudson Valley, is that the hospitals and EMS agencies are not adapted or equipped with high-flow nasal cannula for transportation or treatment of patients. Unfortunately, several of our kids had to be intubated for transportation to another hospital when they were doing okay with high-flow nasal cannula. And this is across that entire region, and I was speaking to some people here in this council which are from other parts of the country which are facing similar misfortunes. So I think proposing a new strategy of incorporating high-flow nasal cannula to ambulances, not just for pediatric patients, but for all patients, will probably benefit our communities.
Thank you, Dr. Quintero. Any other thoughts on potential proposals or discussion?
So, Mr. Chair, one on body cams. That's kind of a hot topic. The other one is on medication and just equipment shortages. How do we address some of those?
Definitely worth discussion. All right, that's actually 10 that we have. Are there any others that anyone would like to propose?
Just remember one yesterday about large events and planning for large events. Was that on your list?
I think there is a large, yeah. I think Lisa has that. Spaskal is working on that currently.
Yes, that's one we're in research that was already accepted last year, so we're in research for that on large-scale events and preparedness.
Just to, before we go on, any other suggestions for any others? It's a pretty full plate right there. So the process at this point, I'm going to recap them in a second, but the process is going to be that for each of the new committee chairs, figure out which of these fits into your wheelhouse and would be adopted by your subcommittee for research and development. And then tomorrow we will need to have some type of verbal proposal for your committee to take on one of the topics or two of the topics as the case may be, and the council will vote on approving the proposal to move into development in each of your committee. As I said this morning, that stops us from losing 3 months along the way with no new proposals working down the road. So for the newly appointed subcommittee chairs, as I read down the list here, think about what falls into your wheelhouse and maybe shoot Clary an email tonight letting him know which one you are going to make a proposal on tomorrow as part of our meeting tomorrow. So just to review, mobile integrated health funding, helicopter landing zone safety, care disparities, the pediatric preparedness, and that's a letter of support, leave behind naloxone, data integration with outcomes, partnering with hospitals, EMS response to active shooter incidents, it was in a Dr. Quintera, yours again was thank you very much. High flow nasal cannula and ambulance utilizations, body cameras, and medication and equipment shortages. So if you can each ponder for each of the chairs tonight, please ponder what you believe fits into your wheelhouse. Shoot Clary an email at some point this evening letting him know what topic you'd like your subcommittee to take up, and then tomorrow just be prepared to speak to it in a very high-level proposal about the work that you'd like to do as part of your subcommittee. Dr. McMullen.
Sure. Would it be inappropriate to have a little bit of open discussion while everyone's here, just so that three of us don't attack one project and leave two others undone?
Sure. Yeah, we're still 8 minutes ahead of schedule, so so feel free. Do any of the committee chairs want to speak specifically to something they are passionate about and feels that fits into their subcommittee?
Sure. I'll make 2 comments. One, my idea of naloxone leave behind may not have a home or may not be appropriate for right now. So I'll try to explore that, see where it fits, but may ultimately suggest that we not take that forward.
Okay.
At least right now.
Sure.
I would actually argue that it could go in equitable patient care.
Okay. All right. Then I will dabble today after dinner.
Sure.
And then for Mr. Arkins, the topic of medication and equipment shortages, since that is somewhat of access to care, that might fall under my subcommittee as well.
That'd be great. Thank you.
Great.
The professional safety would like to take on the helicopter landing zone best practices, is I think what title we would like to go with. I think it falls within that subcommittee.
Thank you, Carol.
Can I make a comment about that?
Of course.
Obviously you just came forward with it, but there's probably already been quite a bit of work done on that through, other industry organizations. If you want to move it forward, then I'll be happy to do the research, but I'm just off the top of my head, I'm sure there's a lot of work that's already been done on that. And look, I was kind of hesitating this morning when I came up, but if you still want to go forward with it, I'll be happy to assist.
I think the discussion this morning was that we would still like to go ahead and do the research part of it. We have identified in the proposal that we will present tomorrow to reach out to those key stakeholders that have already put things together and kind of see where there might be gaps, where it might be training or locating a pre-designated landing zone or utilizing those hospital-based landing pads also. So We realize there has been that, but I think we need to do the research to see if there's benefit in making sure that the training happens for those EMS providers or law enforcement or whoever might be doing the landings also.
Understood.
Right, and to that point, there's nothing to say that you may get into your research and determine there's enough of a body of research and evidence and documentation out there where you don't proceed.
Absolutely.
I saw that. Saw that Mr. Pfeiffer's hand was up.
Yes, I think that the body cams could potentially fit into adaptability and innovation on the adaptability front, sort of evaluation of new technology, but certainly could also fit into maybe some other subcommittees, including integration and technology for obvious reasons. So not trying to claw it away from any other subcommittees that might be interested, but just wanted to offer up that it might have a home with our subcommittee.
Does anyone else feel passionate about grabbing that topic for their subcommittee?
And if you're overwhelmed by your passions, there's nothing wrong with collaborating, subcommittees collaborating on the same topic and having special meetings.
You're a winner, Mr. Pfeiffer.
Okay, that I might challenge you on that phrasing, but we're excited to take this one on. As the representative of practitioners, I actually currently wear a body cam and I work with my agency. I'm familiar with some of the challenges that come along with that, so we're happy to get to work.
Seems like that might be the perfect fit. Dr. Gestring.
You guys switched topics actually before I could comment on the landing zone issue. I think the second part of this was almost as important. It was related to the clarification of EMTALA laws relating to stopping at other hospitals with pre-designated landing zones. And I would be interested to ask our helicopter representative if that's well understood in the industry, because the impression we got was that there's still some question about whether that's a legitimate practice or not. We were hoping to clarify that at the same time. The idea of stopping EMS bringing a patient to a landing zone at an outside hospital and then using that to facilitate transport without actually stopping at the hospital.
I don't think that's well understood. So,
I'm sorry, I didn't hear you.
I don't believe that's well understood.
So there might be some value just in stressing that as well as part of the advisory. Thank you.
Great, thank you, Dr. Gestring.
Mr. Chair.
Sorry, Mr. Wait, Mr. Arkin.
Actually, the the technology committee would be interested in the data integration.
Great. Does anyone feel passionately about clawing data integration away from the technology committee? Okay, thank you. Mr. Brennan.
Sustainability and efficiency would be happy to look at MIH funding, make it fits in with EMS system funding that we're looking at now.
Makes sense. Anyone want to claw MIH away? Okay, great. And who's left? 4, 5. We're missing one committee. We have equitable patient care. We have professional safety, adaptability and innovation, technology, sustainability and efficiency. We're missing one.
Standing by.
Yes.
I think education preparedness would be happy to take on the pediatric preparedness letter on the horizon. We have the large-scale incidents planning and preparedness and research. We have optimal response to 911 and EMD systems, and hopefully going to final next time. I'd be open to EMS response to incidents of violence coming up for research too, if the committee's sufficiently motivated and excited about handling two things at the same time.
Makes sense.
Cool.
Great. Thank you, Lisa. Paul, do you, on the Sustainability and Efficiency Committee, do you feel maybe the equipment and medication shortage dovetails in with your committee? Or does anyone else feel passionately about that topic? Just trying to see where that one has a home, because it's certainly an important and timely topic. Mr. McCollum, Dr. McCollum?
So for the medication and equipment shortages?
Yes.
So that can fall into equitable care if
Okay.
needed. happy to let others take it, but I'm happy to have it sit with us too.
Okay.
So,
Paul?
I'll defer.
I wouldn't have an issue with another subcommittee tackling. I just putting the connection in there when we're focusing on financing and reimbursement and other mechanisms. If you need it, we can add it, but if there's another subcommittee, be happy to pass on it.
Great. You win. Does every committee chair currently have a topic assigned? Great. And Dr. Gestring, you still have motor vehicle crash on the subcommittee, the ad hoc. Sure, of course. Great, makes sense. We are at 15:20 at 3:20, and we need to pause to honor our public comment period. So we will pause. Clary, is there any public comment that's been received?
No, sir. No public comment at this time.
Anything in the chat?
Nothing in the chat.
All right, so we have to stay open for 5 minutes, so take a moment and...
You can continue to discuss proposals if that's something that you'd like to do.
Jeopardy music, yeah. I think we've got every committee chair has a topic, and I think the goal here again tomorrow is going to be to really put out some type of oral proposal on the work that you want to do on that, so that the full council can vote, and then you can take it back to the subcommittee and begin work. So again, I know it's a little arbitrary because you have just overnight to prepare this, but it's just your view as the committee chair of the work. The full committee will be, your subcommittees will announce membership tomorrow, because we wanted to allow the chairs to have an opportunity to reflect on the potential proposals. So that will happen tomorrow. At that point, then we'll move forward with all of the work and the scheduling of those meetings. It's really important that each of you who are on a subcommittee, please do your best to attend each meeting or review the recordings of the meetings so that you can stay up to date on the work that's happening. There's going to be about 8 of you on each subcommittee, and it was by design to do that in such a way where we were increasing membership on the committee so that we had more participants and more engagement. The last round of NEMSAC, it was a smaller amount of participants on the committee, and I think it did create some challenges. So we're anxious about that. We're very much looking forward to that. And as committee chairs, subcommittee chairs, I definitely feel that you really should think about the structure of your subcommittee and how you're going to position people on that subcommittee to get the greatest value and to disperse the work appropriately. As such, Clary did let us know that our consulting company that works with NEMSAC can take minutes for you on your subcommittees. They can do that, so you don't have to assign a scribe or something to take your minutes. But you may want one person on your subcommittee to be responsible for the actual construction of the actual document, because that, I can tell you from our subcommittee, that takes a lot of work. And if you have one person who gets good at doing that, and they can develop those skills in the subcommittee, I think that would be very valuable and take some of the burden off. So really start to think about how you develop that subcommittee, how you develop the roles of the individuals on that subcommittee so that everyone has a fair and equal opportunity to contribute and the work is dispersed throughout the entire group. Questions or comments on that? Clary, we have 2 minutes left. Any comments or on the feedback?
No, sir, not at this time.
All right, we'll give it 2 minutes, or 1 minute, I think we have left. Does anyone have any questions? Any of the new committee members have any questions about what the work of those subcommittees look like?
I just have a question. Are we assigned to a committee, subcommittees, or do we get a choice?
Yes, you are assigned. So last night there was a discussion that took place with Clary, myself, and Tom as the acting chair and vice chair, where we basically researched your background and tried to figure out who would have the greatest value in each of the different subcommittees. So we did our best. And hopefully we did a good job. Hopefully you're all happy with your assignments. I will tell you that when I got put on the Sustainability and Efficiency Committee, I was in a sheer state of panic because finance is not my thing. But I will also tell you that I learned so much more about an area I knew nothing in that it absolutely added value in being on that subcommittee. So hopefully we got it right for all of you. I think we got most of it right, but we'll find out. We're about to close our public comment period. Are there any other comments, Clary?
No, sir.
Okay.
No comments.
All right. So we will close the public comment period, and we'll just take a second and kind of recap what we've done today. I think we've had a very productive day. We now are at a point where we've heard from all of our federal partners and had great introductions from them. I think we, for our new members, have a greater sense of the scope and responsibility of your participation in this council and the importance of the work that this council does. Very excited to have all of you here. As I said, I think it was yesterday, it's like Christmas morning for the members who returned to have new faces and new people that we can learn from and develop friendships with as we work on our common goals. We're very excited about getting to work. We have a full day tomorrow with more reporting. Obviously, our proposals are going to need to go in tomorrow. We did get some of the work done today, such as minutes and whatnot, but there will be more tomorrow. I asked all the subcommittee chairs to make sure that you are ready with some type of auditory proposal tomorrow on your topics so we can move that ball along. I think also, just it's really important, I think, to me as the chair and to Tom as the vice chair, that you understand that you always have our phone numbers and our voices for any type of advice you need. I think that was one thing that many of us in the last council felt we needed more support because we were virtual, it was COVID, there were a lot of things happening, and we want to make sure that we can be there for all of you, for the new members that are joining, so that we get you ramped up to speed very quickly. And I'm sure I speak for all the subcommittee chairs that, please don't ever hesitate to reach out to us, email, call, whatever. We want to make sure that we get you up to speed quickly and that we can get on to the business of, getting some powerful advisories out that help to change our industry for the better. Any comments or questions?
As Chair, I'd just like to reiterate what you're saying about please don't hesitate to reach out, even if it's not about NEMSAC. Reach out to just as another person if you're in our city and you're looking around, you need some advice for something, or even if you're just looking for a good place to go eat. You know somebody in that part of town, give them a call, find out what's going on. Definitely reach out for more than just NEMSAC things.
Great, thank you, Tom. We've had a very productive and informative day today. Thank you to all the members of the public who joined us for our meeting today. Thank you to all the subcommittees for their work, the respective advisories, and thank you to the council representatives for participating and your willingness to serve as your sector representatives. We will reconvene tomorrow at 1 p.m. Eastern Time with federal updates beginning at 1 hour before we reconvene. If there's no other business to discuss, I will open the floor for a motion to recess for the evening.
So moved.
Thank you, sir. Do we have a second? All in favor, please unmute and say aye.
Aye.
Thank you. We stand in recess.